If you've been diagnosed with gout or you've ever experienced a gout attack, you'll know just how painful it can be. One of the most common questions patients ask is, what should I avoid eating? Because for many people, food and drink can play a significant role in triggering gout attacks. In this video, I'm going to explain which foods are most likely to trigger gout, why they do so, and what you can do to reduce your risk. I'm Dr Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the basics. Gout is caused by a buildup of uric acid in the blood. When uric acid levels become too high, it can form crystals that deposit in the joints, leading to inflammation and pain. Now, uric acid is produced when the body breaks down substances called purines. Purines are found naturally in the body, but they are also present in certain foods. So when we talk about diet and gout, what we're really talking about is how certain foods can increase uric acid levels. Let's go through the key triggers. The first group of foods to be aware of is red meat and organ meats. This includes foods like beef, lamb, liver, and kidney. These foods are high in purines, and frequent consumption can increase uric acid levels. That doesn't necessarily mean you need to eliminate them completely, but moderation is important. The second group is seafood. Certain types of seafood are particularly high in purines. These include shellfish, such as prawns, mussels, and crab, as well as oily fish like sardines and anchovies. Again, the issue is not occasional consumption, but regular intake in larger amounts. The third major trigger is alcohol. Alcohol, particularly beer and spirits, is strongly associated with gout. Beer contains purines, and alcohol in general can interfere with the body's ability to remove uric acid. Many patients notice that gout attacks occur after periods of increased alcohol intake. This is one of the most common and significant triggers. The fourth group is sugary drinks and foods. This is something that is often overlooked. Drinks that contain fructose, such as fizzy drinks and fruit juices, can increase uric acid production. Even though these drinks don't contain purines in the same way as meat, they still contribute to higher uric acid levels. Reducing sugary drinks can make a significant difference. The fifth factor is dehydration. While not a food, it's an important dietary factor. If you are not drinking enough fluids, uric acid becomes more concentrated in the blood. This increases the risk of crystal formation. Staying well hydrated is one of the simplest and most effective ways to reduce the risk of gout attacks. Now let's talk about foods that are generally safer. Low-fat dairy products such as milk and yogurt may actually help reduce uric acid levels. Vegetables, even those that contain some purines, do not seem to increase gout risk in the same way as animal-based foods. Whole grains, fruits, and most plant-based foods are generally safe. Coffee has also been associated with a lower risk of gout in some studies, although this can vary from person to person. So the overall message is not just about avoiding certain foods, but about maintaining a balanced diet. Now, an important question is, can diet alone control gout? The answer is that diet plays a role, but it is often not the whole solution. For some patients, particularly those with recurrent gout attacks, medication is needed to lower uric acid levels effectively. Medications such as allopurinol or febuxostat are used to reduce uric acid production and prevent future attacks. Dietary changes can support this, but they are usually part of a broader management plan. Another important point is that sudden changes in diet can sometimes trigger gout. For example, crash dieting or rapid weight loss can increase uric acid levels temporarily, so any dietary changes should be gradual and sustainable. Now let's talk about practical steps you can take. Try to limit intake of red meat and high purine seafood. Reduce alcohol consumption, particularly beer and spirits. Cut down on sugary drinks and foods. Drink plenty of water throughout the day. Aim for a balanced diet that includes vegetables, whole grains, and low-fat dairy. And importantly, if you have frequent gout attacks, speak to your doctor about whether long-term treatment is needed. Now, when should you be more concerned? If you are having repeated gout attacks, that suggests that uric acid levels are persistently high. If gout is left untreated, it can lead to joint damage over time. In some cases, it can also lead to the formation of tophi, which are deposits of uric acid crystals under the skin. So while gout is very treatable, it's important not to ignore it. To summarize, certain foods and drinks can increase the risk of gout by raising uric acid levels. Key triggers include red meat, organ meats, seafood, alcohol, and sugary drinks. Staying well hydrated and maintaining a balanced diet can help reduce risk. However, for many patients, diet alone is not enough and medical treatment may be needed. If you've experienced gout, understanding your triggers is a key step in managing the condition and preventing future attacks. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.